You're sitting at the breakfast table. Coffee's hot. The morning light is doing that thing you like through the kitchen window. Everything is fine. You clear your throat, just a quick habit, something you've done 1,000 times, and nothing moves. So you do it again, and again. And somewhere between the second cup of coffee and the morning news, you realize you've been doing this for months, maybe years. You just stopped noticing. You're not sick. You don't feel sick. You went to the doctor, they looked at you, maybe said something about allergies or postnasal drip, handed you a box of antihistamines, and sent you home. And it helped a little for a while. But the clearing never stopped. Here's what I want you to understand before we go any further. That constant throat clearing, that sticky, maddening sensation of something always sitting just behind your voice, is not a minor inconvenience. It is your body sending you a message. And most people over 45 have been misreading that message for years. Stay with me through all 5 causes I'm going to walk you through, because number 3 surprises almost everyone, even people who've been dealing with this for decades. And number 5 is the one that gets overlooked in nearly every clinical conversation. I've seen it dozens of times. My name is Dr. Everett Cole. This channel exists for one reason: to give you the medical information that too often gets lost between the waiting room and the parking lot. Before we get into the 5 causes, I want to give you a framework that will make everything that follows click into place. I call it the drainage hierarchy. Here's how it works. Your body produces somewhere between 1 and 2 liters of mucus every single day. Most people are stunned by that number, but it's true, and under normal circumstances, you swallow it without ever knowing it happened. It moves invisibly. You don't feel it, don't taste it, don't think about it. It just does its job, trapping particles, moistening membranes, protecting your airways, and sliding quietly down into your stomach. Now think of your throat like a drainage pipe. When that pipe is the right diameter, the right temperature, and the mucus is the right consistency, thin, watery, mobile, everything flows. You never know the system exists. But when something disrupts that balance, inflammation, pH shifts, nerve sensitivity, structural changes, the mucus thickens. Or it increases in volume. Or the nerves that were silently processing it suddenly become acutely aware of it. And here's the analogy I want you to hold on to. It's like a slow leak behind a wall. The problem didn't start today. The damage has been accumulating. The leak was already there, you just finally noticed the water stain. That's the drainage hierarchy. When it's working, it's invisible. When it's disrupted, even slightly, you feel it with every breath. Keep that in mind as we go through each one. 1. Here is something most physicians don't say out loud at a routine visit. The most common cause of chronic throat mucus in people over 45 has nothing to do with your throat. It starts in your stomach. The condition is called laryngopharyngeal reflux, LPR, and it is fundamentally different from the heartburn that most people recognize. With classic reflux, you feel the burn. You know something is wrong. With LPR, there's often no burn at all. The acid travels all the way up from your stomach, past your esophagus, and reaches the back of your throat, sometimes the voice box itself. And the only symptom you notice is a persistent need to clear your throat. But here's what most people miss. The acid doesn't need to be there constantly to cause damage. Even brief, infrequent exposures to acid at the level of the larynx can trigger a protective response. And that response is exactly what you feel as excess mucus. Margaret, 58, a retired school librarian from Burlington, Vermont, had been clearing her throat every few minutes for 3 years. She described it as a pebble that never quite came out. She'd seen 2 ENT doctors and an allergist. She'd tried nasal sprays, antihistamines, decongestants. Her symptoms were worst in the mornings, which is a very specific clue, and she noticed that they improved when she stayed upright and walked after eating. She came to me because her voice was changing. It had gotten slightly hoarse, and she'd assumed it was age. It wasn't. It was LPR. We did a trial of dietary modification, changed her eating schedule, nothing before bed, nothing acidic after 6 p.m., and within 6 weeks, the throat clearing that had consumed 3 years of her mornings had quieted to almost nothing. The mechanism here is worth understanding. Your larynx, the structure that houses your vocal cords, has very few acid-resistant receptors. Your stomach lining is built for acid. Your esophagus has some protection, but your larynx? None. Even a small amount of acid landing there, a quantity that wouldn't even register in your chest, triggers an immediate inflammatory response. The mucus glands of the larynx respond by producing more secretion. The nerves become hypersensitized, and you end up in a loop. The acid causes mucus, the mucus causes clearing, the clearing causes more irritation, which causes more mucus. This is where things get interesting. A 2019 study published in JAMA Otolaryngology found that LPR was the underlying driver in over 50% of patients presenting with chronic throat clearing symptoms who had previously been diagnosed as having allergic rhinitis. Half. Misdiagnosed, or at minimum, incompletely diagnosed. What to do? Start by changing your timing, not just your diet. Nothing to eat within 3 hours of lying down. Elevate the head of your bed by 6 inches. Not with pillows, which actually flex the wrong way, but with something under the mattress itself. Avoid coffee, alcohol, mint, and carbonated drinks in the evening. These aren't just suggestions. They directly reduce acid exposure at the laryngeal level. And if you have morning hoarseness that takes more than 30 minutes to clear, that changes things. Talk to your doctor. That's a specific sign of nighttime reflux reaching your voice box. We'll come back to that idea of nerve hypersensitivity in a moment, because it shows up again in cause number 3 in a way that changes how you should think about this entire problem. 2. Here's something that will feel counterintuitive. Drinking more water may be the single most effective thing you can do for chronic throat mucus, not because it thins the mucus directly, but because dehydration fundamentally changes the properties of mucus at the cellular level. Most people in their 50s and beyond are mildly chronically dehydrated, not dangerously so, just enough to tip the balance. And one of the first systems to register that deficit is the mucosal lining. Hold on to that thought. We'll see why this matters even more when we get to cause 4. James, 61, a weekend fisherman and former postal worker from Baton Rouge, Louisiana, came in complaining of thick, sticky mucus that he described as being worst in the afternoon. He tried every over-the-counter product available. He tracked his symptoms with a notebook, which I always appreciate in a patient, and when I looked at his log, the pattern was obvious. His worst days were his longest days outdoors. His best days were Sundays when he stayed home. He was drinking coffee in the morning, maybe a sports drink at lunch, and not much else. His daily fluid intake was under a liter. He was a large man who spent hours in the sun. He was profoundly dehydrated by afternoon, and his mucus was telling him so. The biology here is precise. Mucus is approximately 95% water. The remaining 5% is a network of proteins called mucins. They're what give mucus its gel-like texture. When you're well hydrated, mucins are loosely cross-linked, and the resulting mucus is thin, mobile, and moves easily. When you're dehydrated, mucins become more densely cross-linked. The mucus thickens, it sits, it accumulates in the throat rather than flowing through it, and the nerve endings in your pharynx, which are always monitoring the surface of your throat, register the change and tell you to clear. A systematic review published by the European Respiratory Journal confirmed that even mild dehydration, a 1 to 2% reduction in body water, measurably affects mucus viscosity and mucociliary clearance, which is the biological process your body uses to move mucus upward and out of the airway. The practical guidance is simpler than most people expect. Aim for half your body weight in ounces of water per day. That's a rough target, not a prescription. Drink consistently throughout the day rather than catching up in the evening. Reduce alcohol and caffeine, both of which are diuretic. And note that the sensation of thirst becomes a less reliable signal as we age. By the time you feel thirsty after 50, you're already behind. And if you're on diuretic medications for blood pressure or heart conditions, that changes things. Talk to your doctor about whether your hydration needs to be specifically managed. 3. This is the one that most people in their 50s have never heard, and it explains why so many cases of chronic throat mucus never fully resolve, even after the reflux is treated and the allergies are managed. The nerve itself becomes the problem. There's a condition called sensory neuropathy of the laryngeal nerve, or sometimes chronic laryngeal hypersensitivity, and it works like this. After months or years of real irritation from acid, allergens, infections, or dryness, The nerve fibers that monitor the surface of your larynx undergo a process called peripheral sensitization. They lower their threshold. They start firing in response to stimuli that should be below the level of awareness. A tiny droplet of saliva, a change in temperature, the movement of completely normal mucus. This is where things get interesting. It's the same mechanism responsible for chronic pain after an injury. The signal was originally appropriate, and then the nerves got stuck in the on position. Patricia, 67, a grandmother who gardens every morning and winters in Scottsdale, Arizona, had been managing her reflux successfully for years. Diet, medication, lifestyle changes, she'd done everything right. The reflux was under control. Her gastroenterologist was satisfied, but the throat clearing never stopped. Her new ENT described it as a habit. Her family had started to agree. But when she came to see me and I listened carefully to the history, the original timeline, the quality of the sensation, the fact that it was triggered now by things as minor as cold air or a sip of water, it pointed clearly to nerve hypersensitivity. We treated her with a low-dose neuromodulating medication, originally developed for nerve pain, along with a behavioral retraining protocol to interrupt the clearing reflex. Within 3 months, she told me she'd stopped being aware of her throat entirely. She called it the first quiet she'd had in 7 years. The mechanism involves a nerve called the superior laryngeal nerve, a branch of the vagus, which is responsible for sensation over the laryngeal surface. Under chronic irritation, the C-fiber nociceptors, the slow, unmyelinated pain fibers, upregulate their expression of substance P, a neurotransmitter that amplifies sensory signals. The threshold for firing drops. A sensation that previously required a significant stimulus, a piece of food, a rush of acid, now fires in response to almost nothing. A paper published in the Laryngoscope described this population as refractory chronic laryngeal hypersensitivity and noted that patients had typically seen an average of 4 specialists before receiving the correct diagnosis. What to do? If you've treated the obvious causes, reflux, allergies, dehydration, and the throat clearing persists, ask specifically about laryngeal sensory neuropathy. The treatment approach is different and completely distinct from antihistamines or antacids. Low-dose amitriptyline or gabapentin, used not for depression or seizures, but specifically for their nerve-calming properties at subtherapeutic doses, have shown real benefit. Behavioral cough suppression techniques also help, and if you've been told this is just a habit, after years of trying to fix it, that itself is important information. Push further. Has throat clearing or a sensation of mucus you can never quite clear affected your daily life, your sleep, your social confidence, your voice? Type clear in the comments if this is resonating. I read every one. 4. The connection between what you breathe and what accumulates in your throat is more direct than most people realize, and it goes well beyond seasonal pollen. The average home in the United States contains measurable levels of at least 2 to 3 common airborne irritants at any given time. Dust mite proteins, pet dander, mold spores, volatile organic compounds from cleaning products, synthetic carpeting, or pressed wood furniture. And your upper airway, the very first tissue these particles contact, responds to all of them the same way, by producing more mucus as a protective barrier. But here's what most people miss. The response doesn't require an allergy. You can have a completely normal allergy panel, no IgE elevation, no positive skin test, and still have a chronic upper airway inflammatory response to environmental irritants. The mechanism is different. It's called non-allergic rhinitis, and it accounts for a significant proportion of unexplained chronic throat mucus in middle-aged and older adults. Robert, 54, a retired firefighter from Colorado Springs, Colorado, knew his lungs had taken a hit over 30 years of work. He expected the cough. He expected some shortness of breath on cold mornings. What he didn't expect was that his worst months for throat mucus were November through February, when he was spending the most time indoors. He'd assumed outdoor air was his problem. In fact, the forced air heating system in his home was drying and circulating particulates at a level his upper airway couldn't handle. We addressed his indoor air quality HEPA filtration, humidity management, removing the carpet in the bedroom, and his symptoms dropped by more than half without a single medication change. Physiologically, your nasal passages and the back of your throat are lined with a layer of pseudostratified ciliated epithelium. Think of it as a carpet of microscopic hairs, each beating 10 to 15 times per second to sweep particles and debris upward. When irritants are present chronically, this epithelium becomes inflamed, the cilia slow down, and the goblet cells, the mucus-producing cells embedded in that same tissue, upregulate their output. Thicker, slower mucus, produced in greater quantities, draining into your throat constantly. The EPA has repeatedly documented that indoor air quality in American homes is, on average, 2 to 5 times more polluted than outdoor air, and we spend roughly 90% of our time indoors. Start with humidity. Indoor air below 30% dries mucus, making it thicker and slower to clear. Above 50%, you're encouraging mold and dust mite growth. Aim for 40 to 50% with a quality hygrometer and a humidifier or dehumidifier as needed. Run a HEPA air purifier in the bedroom where you spend a third of your life. Wash bedding weekly in hot water. If you have pets, keep them out of the bedroom. These aren't small changes, they directly reduce the load your upper airway is fighting every night. And if you also have persistent eye irritation or a chronic runny nose that your doctor has labeled non-allergic rhinitis, that changes things. Talk to your doctor about prescription nasal steroid sprays, which are different from and often more effective than antihistamines for this specific mechanism. And this changes everything. The indoor environment you return to every night is either healing or irritating your airway while you sleep. That's 8 hours of either recovery or damage, repeated 365 times a year. 5. This is the one nobody talks about until they've already been dealing with it for years. It has nothing to do with infection, allergies, or reflux. It's a medication sitting in your medicine cabinet right now. ACE inhibitors, a class of blood pressure medication used by tens of millions of Americans, cause a chronic, dry, irritating cough and a persistent throat-clearing sensation in somewhere between 10 and 30% of people who take them. The percentage goes up with age, and it goes up again in women. The mechanism is a buildup of a substance called bradykinin in the airways. CE inhibitors block an enzyme that normally breaks bradykinin down, and when it accumulates, it directly stimulates cough receptors in the larynx and trachea. And this is the critical part. Your doctor may have told you about the cough, but the throat mucus sensation, the feeling of something always needing to be cleared without a cough, is less frequently mentioned, and many patients and some physicians don't connect it to the medication. Dorothy, 72, a retired music teacher from Savannah, Georgia, had been on lisinopril for her blood pressure for 9 years. She had adjusted to a mild cough within the first year, as her cardiologist had told her she might. But in the past 3 years, the throat clearing had become consuming. She was doing it during her piano lessons with students. She was doing it mid-sentence in conversations. She'd seen an ENT who diagnosed postnasal drip. She'd been on nasal steroids for 2 years. When she came to me and I looked at her medication list, lisinopril, 10 milligrams, 9 years, I asked her a single question. When exactly did the throat clearing get worse? She looked at her chart and told me the timeline. It was within 6 months of her dose being increased from 5 to 10 milligrams. We switched her to an ARB, a different class of blood pressure medication that works through a related but different mechanism and does not cause bradykinin accumulation, in coordination with her cardiologist. Within 6 weeks, her throat clearing had stopped. 9 years of a sensation she had come to believe was simply who she was, gone. The evidence on this is unambiguous. A meta-analysis published in the British Journal of Clinical Pharmacology documented ACE inhibitor-induced cough and laryngeal irritation across 249 controlled trials and confirmed the mechanism is a direct drug effect, not a coincidence, and not psychosomatic. What to do? Look at your medications. If you take an ACE inhibitor, lisinopril, enalapril, ramipril, benazepril, or any drug ending in pril, and you have chronic throat clearing that started or worsened after you began or increased that medication, bring it to your prescribing physician's attention. Do not stop the medication without medical guidance. Your blood pressure management is important, but ask specifically whether an ARB might be an appropriate alternative for your situation. And if you've mentioned the symptom before and been told it's unrelated to the medication, that itself is important information. A second opinion from a physician familiar with this literature is entirely reasonable. Now I want to give you something you can take out of this video and into an actual doctor's office. I call this the 5-question protocol for chronic throat mucus. These are 5 questions you can bring verbatim. Ask them in this order. 1. Could this be laryngopharyngeal reflux rather than allergic postnasal drip? Can we distinguish between them? 2. Is there a medication on my current list, particularly any ACE inhibitor, that could be driving or worsening this symptom? 3. If I've already treated reflux and allergies without full resolution, is laryngeal sensory neuropathy a possibility, and what's the evidence-based treatment approach? 4. Should we evaluate my indoor environment air quality, humidity, allergen load as a contributing factor before adding more medications? 5. If this has been going on for more than 6 months without full resolution, what is the next diagnostic step? Not the next medication, but the next test or referral. Write those down, bring them. Any good physician will welcome these questions, and if yours dismisses them, that itself is important information. There's a larger truth underneath everything I've told you today. Your body has been communicating with you through this sensation, this sound, this daily interruption, and for a long time, the response from the medical system has been to hand you something that quieted the signal without explaining it. That's not always wrong. Sometimes you need relief first. But if you're 45 or 55 or 65, and this has been going on for years, you deserve more than management. You deserve an explanation. What I hope you're leaving with is not just a list of causes, but a different posture toward your own symptoms. The clearing is not a tic. It's not anxiety. It's not just getting older. It's a signal, and signals have sources. You have the right to understand the source. You have permission to push back. You have permission to ask for a different medication trial. You have permission to request a referral. You have permission to say, I've been dealing with this for 3 years and I'd like a more complete workup. That is not being difficult. That is being a patient who understands that your health is worth the conversation. So let me ask you this. How long have you been dealing with this? 6 months? 5 years? Does anyone else in your life have this same problem that you know of? Drop your answer in the comments. I want to understand who's watching this and how long this has been going on for people before they found their way to a video like this one. If this gave you a new way of thinking about something you'd nearly accepted as permanent, subscribe. I put out videos like this every week, evidence-based and honest. You deserve health information that treats you like an adult.